Good afternoon, everyone. So the COVID pandemic was a good time for us to look at the effects of nutrition on our ability to fight infections. So a type of study that's hard to do. So here's the outline of my talk. I will look at the intersection of nutrition, comorbidities, and COVID-19, nutrition, immunity, and gut microbiome, and the studies of impact of nutrition on COVID-19. So it's quite alarming that our diet is the #1 cause of disease and disability in the US. So on the top, there is dietary risks, followed by tobacco use, hypertension, high BMI, diabetes, hypercholesterolemia. And more American adults are sick than healthy. About half have diabetes, half have a lifetime risk for cancer, 3/4 are overweight or obese, and only 1 in 15 is metabolically healthy. And we're seeing high numbers of these comorbidities among our teenagers. So I think of COVID-19 as a fast pandemic on a slow pandemic. And the slow pandemic, as you know, is the pandemic of obesity and its related comorbidities. And then came COVID-19, a very rapid pandemic, and it really allowed us to tease out the different parameters and how they may impact morbidity and mortality related to COVID. And COVID is or the SARS-CoV-2 has, both vascular and inflammatory effects. The comorbidities that are associated with really high risks for mortality and hospitalization and other complications are, obesity, diabetes, hypertension, heart disease, among others. So in essence, about 2/4 of the hospitalizations could, easily be attributed to our metabolic risk factors. So as you see here, severe obesity was associated with over nearly 5-fold risk for hospitalization, followed by kidney disease, diabetes, obesity, and hypertension. So how does COVID-19 impact disease severity in obese patients? So there's a number of parameters. So obese patients, have an altered respiratory physiology. And the receptor for SARS-CoV-2 virus is present among other tissues in the adipose compartment. And so there is more a receptor for the virus to bind to. And as we saw in the earlier talk, obesity is a pro-inflammatory state. So there are, more of the pro-inflammatory cytokines that are already present in the body. And on top of that, we, have the SARS-CoV-2 infection, which, in itself induces a pro-inflammatory state. So patients with more severe disease, end up developing ARDS and respiratory failure, as well as, thrombotic complications such as strokes. And so we have much more, of a severe cytokine storm among patients who are obese. And there is also an immune system impairment in obese patients. So there is, B cell and T cell impairment. So there is, a poor immune control of the virus, and there is, more virus replication and also more disease severity. So while the pandemic allowed us to, very clearly see the effect of these comorbidities on hospitalization and mortality risks for COVID-19, but the SARS-CoV-2 is not the only virus that's associated with poor outcomes in obese patients. There is also, other viruses such as influenza. And obesity has also been shown to impact the immune response to influenza virus, related to a vaccine. So the vaccines are less efficacious among obese patients. So as we know, that meat-based diets are associated with higher BMI. And so what we see here is that people, with the higher BMIs, even when they get the vaccine. So here we have on the x-axis, we have BMI, and y-axis is the hazard ratio. So even after the first dose of the vaccine, patients continue to have, high risk, of severe illness or in hospital admission. And this continues after the second dose. So the vaccine effectiveness is not as, good as in persons with normal BMI. And again, mortality and morbidity for both, SARS-CoV-2 infection as well as vaccine breakthrough infection are again much higher in patients, who have these comorbidities, obesity, diabetes, cardiovascular disease, all, related to all morbidities that are much higher in people with meat-based diets. So what about the impact of nutrition, metabolic disease, and exercise on the immune response? So really, our immune response to SARS-CoV-2, and I'm going to say, in essence, really our immune response to, a variety of pathogens depends on our nutritional status, our activity level, as well as our healthy gut flora, all promoting a good immune response, whereas both malnutrition as well as obesity and age are associated with more weaker immune response. So, more likely to have uncontrolled infection with these conditions. So to summarize factors that depress the immune system, besides our age, there is malnutrition associated with micronutrient deficiencies, but also obesity, because as we see that obesity is a low-grade chronic inflammatory state that is associated with a premature aging of our immune system, but others as well: heavy alcohol consumption, environmental pollutants, autoimmune disease and immunodeficiencies, and stress and lack of sleep. So what is an immune boosting diet? So immune boosting diet would be a diet that supports our immune cells to initiate effective responses against pathogens, but also to abort the immune responses when that immune response, when the job of that immune response is done. So this is what we saw with COVID-19. It was that severe inflammatory response that we would see in a lot of patients, particularly patients with high BMIs and other comorbid conditions, which would cause patients to develop ARDS because that inflammatory response was not, controlled. It was not regulated appropriately. And then a variety of diet and a varied diet with appropriate amounts of micronutrients. And some micronutrients, have specific roles in immune function, including vitamin C, vitamin D, zinc, selenium, iron, and glutamine, which one can, get via a varied plant-based diet. And a diet that I'm going to talk about a little more, a diet that supports a healthy gut microbiome. So a gut microbiome has, over the recent years been shown to be, important for our normal immune function. So we have trillions of microorganisms that live mostly in our intestines, and our intestines are an important major site of immune activity and production of antimicrobial proteins, because that's where, a lot of pathogens first meet our body. And diet is key in determining the microbiome. And a typical diet, it's nice to think of it as a probiotic and prebiotic, component And a diet containing both is ideal. So probiotic foods are, foods that contain live helpful bacteria. And prebiotic foods contain fiber and oligosaccharides that feed and maintain healthy colonies of these bacteria. So when we're eating a high fiber, plant-rich diet that really supports the beneficial microbes, which break down fibers and short chain fatty acids to stimulate immune cell activity. And in terms of probiotic foods and the helpful bacteria, really a lot of them are contained in our fruits and vegetables. So even when our fruits and vegetables are washed, they still have a lot of healthy bacteria on them. As well as, of course, fermented foods. So eating a variety of fruits, vegetables, beans, and whole grains really supplies the needed prebiotics and the probiotics. And it's important to think about food and obesity as being more than calories. So, and we heard some of that in the last talk. So it's not just calories, it's where those calories are coming from, and where all the proteins are coming from. So, and is the diet able to support a healthy gut microbiome? So, low calorie does not, necessarily equate less weight gain. And fat-free is not just, healthy, because the fats may be substituted by, carbohydrates that may not be healthy for the body. And, vitamin fortified does not necessarily mean good for you. So it could be foods, often that are heavily processed or ultra processed that end up containing more and more of the vitamins. So, thinking about foods that give rise to life, so foods with simple ingredients, minimally processed. So those would be important for maintaining good health. So plant-based diets were already known to be beneficial to human health before emergence of SARS-CoV-2. And as we know, comorbidities such as high BMI, coronary artery disease, hypertension, diabetes is strongly linked to diet and lifestyle choice. Specifically, a plant-based diet decreases the risk of the very health conditions that put our population at such a great risk for COVID-19 mortality and morbidity. So this Howard study was an observational study that looked at over 500,000 middle-aged and older individuals. And this started just as the pandemic broke out. And they were asked, what they ate in February 2020, and then followed their health through September. And what was found was that the dietary pattern of individuals eating healthy plant-based foods was associated with nearly half lower risk of severe disease. So not such a high risk for lowering of infection, which is expected, that people were still susceptible to infection, but they had much lower likelihood of developing severe disease. And this is very exciting. And this is before the period of the vaccine. So just a nutritious diet was able to help lower the risk of severe disease. And this is a second study that was looked at severity of COVID-19 in healthcare workers. And here they looked at about 568 patients with COVID-19 and over 2,000 controls. And these were healthcare workers from 6 different countries, including the US, with substantial exposure to COVID-19. And after adjusting for various confounders, they divided the patient subjects into either plant-based diets or pescatarian diets. And what they found was that the lowest risk for severe disease was among those eating plant-based diets. And somewhere in the middle were the pescatarian diets. And let's take a look at the graphs here. And the different models are, different types of adjustments that were made in each model, such as age and comorbidities. But what you can see is people who were consuming high protein plant-based diets had the lowest risk for severe disease, and plant-based or pescatarian diets or some combination of that were next. And these high protein diets, these were people who were eating meat-based diets, and the risk for disease severity among these healthcare workers was much higher than the other groups. So to conclude, to tackle the challenges of COVID-19, as well as I'm going to say a lot of our infectious diseases, we must address lifestyle risk factors such as nutrition, smoking, and lack of physical activity. And really kind of importantly is educating people about good nutrition. So adopting a healthful plant-based diet and lifestyle is a powerful and effective tool to delay the aging process, decrease age-associated comorbidities, and decrease the risk of severe COVID-19 and mortality, and also reduce the risk for several other infectious disease processes. And by providing an immune boost, a healthful diet and lifestyle, like I mentioned, will mitigate the severity of other infectious diseases as well. So yeah, so food is medicine, medicine is food. Thank you.